Health Answers. The current pandemic demonstrates the need for a new approach, shifting our perspective away from only treating disease to preventing illness and really working towards a healthier lifespan. So how can we improve health and healthcare systems while targeting individuals and communities? As public health is often described as interdisciplinary and innovative field, I am very honored to introduce you to Mr. Eliassen. He is the Director of Health at the Copenhagen Institute for Future Studies and has a background in political science. His expertise lies in combining various fields of knowledge. So thank you very much, Mr. Eliassen, for joining us today. I'll start with my first question. Can you explain the concept of personalized health and how we can support this concept during times of COVID-19?
Thank you for having me. Yes, personalized health is something we need to describe going back to where it started, because mostly we have worked with precision or personalized medicine, which then is inside the clinical field, while personalized health goes a bit broader on what is relevant for your health. And there are many definitions of precision medicine, personalized health, personalized medicine, stratified medicine. The words are very different, but pointing into the same direction. We actually did a work last year trying to combine, I think, an essence out of 19 different definitions, which most people then agree on. But in the end, this is about admitting that one size fits all has been very good for development, but we need to get the next step now. We know that the biology and how we respond to different treatments is different, and we also have the tools to understand a part of that difference. But it's also very important to look at not just what can we do when we're ill, but also what can we do in order not to get ill. And a part of that is to have the right kind of interventions for the right persons at the right time. And this has been very embraced for the medicine part, but this is probably also the case for the prevention part on the behavioral side.
How can we implement COVID-19 policies while considering the concept of personalized health?
Yeah, and here it comes back to what might be the essence of what you are doing and the topics you are working with. I think the next thing we really need to embark on and push forward, which has been started in pockets, is to bridge public health and personalized health. Most of the time, this is seen as conflicting between the actors in the field and generally as a concept. But I think it's quite clear and more widely understood during the COVID crisis that if we don't think public health and at the same time think about how different individuals respond to both treatment and to the same disease in different ways, it's going to be very hard to be effective. So I think that is actually the biggest challenge we have ahead of us in a structural and ideological and concept-wise manner is how do we bridge these two very important fields.
So you already mentioned bridging personalized health with public health. Can you give us further key insights why the connection between personal and community well-being is crucial, and why it is also essential during a pandemic like COVID-19?
So there are several reasons. One reason why we also have so big difficulties dealing with the pandemic is that a pandemic by its nature it's a biological challenge. Our response are very much structured in a industrialized way. So that's more on how we make societies, which seems to have a hard time responding to this. But when it comes to this COVID crisis itself, so if we didn't have all the science behind personalized health, which mainly has been driven forward by genomics, we would not have the understanding of the virus as we have today, which makes us able to work with it, understand mutations, being faster and working with vaccines. So that's also a part that comes in. But what has happened and what should not have happened, or at least most of us hoped would not happen, is that the countries went back to a city-state logic and locked down into themselves. While we, with our logic, and a part of the research community has done so, we need to work cross-border in order to solve issues like this. So I think one of the crucial and hard question here, and I think it's also important to realize that we are on the verge of a new paradigm, how to work with health. So it's very important to ask questions before we think we have solutions. And what is very important here is that, do we really want to be better protected against a crisis like this? Because that requires data sharing across boundaries in different ways. And so are we ready to take that step? And I see politicians and decision makers calling for the action of more resilience and readiness towards a crisis like this, but being totally against embarking on a regime of the necessary data sharing.
Has COVID-19 shifted the perspective from treating disease to preventing disease?
I think COVID has changed some things. So I've been one of these Don Quixote that has been banging on the windmills for the last decade, talking about the digital health and data sharing, and nobody understood it. And then you have a tiny biological incident that then changes all these thoughts in matters of weeks. So yes, it has changed the understanding of some of these things. And yes, we have had an acceleration on innovation, but the innovation has been done in the old industrial way for most cases. And we have also seen a lot of rollout of substandard solutions, which, it's not, even if we need to work faster, it doesn't mean we need to throw away standards and secure the safety measures that we have used hundreds of years to develop. So that's a challenge in it. Has it put a focus on prevention? Definitely, because people have also, societies and individuals have also learned that behavior is crucial in order to avoid some diseases, at least, and that also gives some food for thought on how to work in a public health manner. Where it's really needed, what we have worked a lot with at the Institute, is a concept we call the humanome. So how can we work with a way where the individual has access to all relevant data for them? Not waiting until you're ill, but having validated data, being your behavior, being your clinical data, being your biological expressions, being your micro and micro environmental data, and whatever data the system you live in has on you, but presented in a way so you actually can act in a way that you choose yourself on having what is the good life for you. Because what we are asking for, and believe me, I've been to a lot of personal health conferences. What we are asking for from the individual is, give us your data so we can have some aggregated understanding. But if we want to work with personalized health, the data we need to use with the person is not average, it's the person's data. So personalized health is not using average data, and that's where it becomes very important to understand that we need to have a data loop where we have real-time data floating from the individual to some kind of an aggregated data enricher that both has then the public health understanding, but also enriches the data that we can use for the individuals. So what we need to move away from is the clash between the individual and the system being a private or a public holder of data, and actually merge this to a mutual benefit. And we don't have the paradigm for that. So that's also where we need to ask the question and push for a solution on it. Because in the end, we again need to ask, do we really want personalized health? And if we want it, this is one of the things we need.
So thank you very much for joining this session and sharing your knowledge, as well as emphasizing the need to combine public health with personalized health, giving people the data before they actually get the disease, and also taking behavior science more into account.